Now that you have been discharged from the hospital, this video will give you instructions on how to care for yourself at home. The cardiac surgery team is here for you 24 hours a day, and a member of our team will call you in 3 to 4 days to check on you. For more detailed information, refer to the booklet you were given at discharge, Recovering from Heart Surgery. When you get home, there are a few things you need to do each day. Take all of your medications as directed. When you are discharged, you'll be given an updated medication list. A cardiac surgery team member will prescribe any new prescriptions necessary. After you leave the hospital, make sure to pick your medications up right away. If possible, have a friend or a family member do this. Weigh yourself at the same time each morning after you go to the bathroom and before you eat breakfast. Keep track of your weight and call the cardiac surgery team if you gain 1 to 2 pounds a day for 2 days or 5 pounds in 1 week. Take your temperature and keep a log. Call the cardiac surgery team if your temperature is more than 101 degrees Fahrenheit twice in a 24-hour period. Examine your incisions. Always wash your hands before touching any incisions or wounds. Call the cardiac surgery team if you notice any signs of infection, such as increased redness, warmth, swelling, tenderness, drainage from the incision, or separation of your wound. Shower daily. No tub baths until instructed by your team. It's important to have clean skin to protect your wounds. Shower with your back to the water stream. Let soapy water run over your incisions and pat dry with a clean towel. Do not pick or peel Dermabond glue or scabbing on any of your incisions. Let them fall off on their own. Don't use any lotions, creams, or powders on the area for 6 weeks after surgery. Continue to wear your compression stockings at home for 2 weeks to decrease swelling and prevent blood clots. You may take them off at bedtime to wash. When sitting or resting, elevate your legs to help decrease swelling. It's very common to have swelling after surgery. These steps should help improve that. If you noticed increased swelling, please call the cardiac surgery team. Continue to use your incentive spirometer every 2 hours when awake. This will help to keep your lungs clear and healthy. Here's how to use your incentive spirometer. Hold the incentive spirometer in an upright position. Place the mouthpiece in your mouth and seal your lips tightly around it. Breathe in slowly and as deeply as possible, raising the blue piston toward the top of the column. Hold your breath as long as possible, at least 3 to 5 seconds. Allow the piston to fall to the bottom of the column. Rest for a few seconds and repeat these steps at least 10 times every hour while you are awake. A good way to remember is to use it every time there is a commercial on TV. Follow sternal precautions for 6 weeks. Do not push, pull, or lift more than 10 pounds, which is like a gallon of milk. For example, don't push off the chair with your hands when you stand up. No walking your dog, pushing a lawnmower, or vacuuming. Avoid activities that cause you to bear down. Hug a cushion or a pillow when coughing or sneezing. Use the log roll technique to get in and out of bed. Stop any activities that cause pain or discomfort in your incision. Don't drive until you have been cleared by the cardiac surgery team, usually at your 6-week appointment. During this time, your breastbone is still healing and your body is recovering from surgery. Even after you have been cleared to drive, do not drive if you are taking prescription pain medications. You may ride as a passenger in a car at any time. The seatbelt should always be worn. It is preferred that you sit in the back seat to avoid airbags. Walk 3 to 4 times a day, slowly increasing your time to get stronger. This is one of the best forms of exercise. It is important to increase your activity gradually. Walk at your own pace. In the beginning, start on a flat surface. Be sure to wear comfortable non-skid shoes to prevent falls, and stop and rest if you feel tired. Pace yourself with your activities throughout the day. Don't try to do too many things at one time. Make sure you get enough rest and sleep. It's very common to have sleeping troubles after surgery. You may feel better as you get back to your regular routine. Limit naps during the day and try to avoid products with caffeine if you are having trouble sleeping. Manage your pain. It's important to take over-the-counter pain medication to keep your pain under control. Take your prescription pain medication before your pain gets too bad. If your pain is not controlled, call the cardiac surgery team. Make sure you are eating to help you heal. It is common to have loss of appetite after surgery. In the hospital, you were given handouts about the best foods to eat to help with healing. You shouldn't try to diet after surgery until cleared by your cardiac surgery team. Patients with diabetes should test and record their blood sugar levels daily. Call the cardiac team if levels are over 180 2 times or more in a 48-hour period. Women with a bra cup size of C or bigger should wear a supportive bra without underwire. Always wear your bra to bed and when lying down. This may be taken off 2 times a day for 1 hour to allow for bathing and your skin to breathe. Change and wash your bra every day. Keep all of your follow-up appointments. You will see a member of the cardiac team at 2 and 6 weeks after discharge or sooner if needed. Typically, you will see your cardiologist 4 weeks after discharge and your primary care provider 6 weeks after discharge. These future appointments should be scheduled at or shortly after discharge to ensure you are seen in a timely fashion. Call our office if you don't have these appointments scheduled. There are some things that need immediate attention at the local emergency room. If you have any of the following symptoms, call 911. Chest pain or other symptoms like you had before surgery. Fast heartbeat or palpitations with shortness of breath. Shortness of breath not relieved by rest. Coughing up of bright red blood. Sudden numbness or weakness in arms or legs. Sudden severe headache. Fainting spells. Severe abdominal pain. Bright red stools. Recovery from surgery takes some time. You'll have some days that are better than others, but each week should get better. Your team will be here for you throughout your recovery. Thank you for watching. Call our 24-hour phone line with questions at 508-334-PUMP. That's 508-334-7867.